Dyslipidemia management. If LDL is below 70, no treatment is needed. Primary prevention is preventing risk factors to developing into a disease, ASCVD. Usually, LDL is, if it is more than 190, we will give high intensity statins. Less than 100 of LDL after 3 months of high intensity statins, then we will continue the statins in the same dose. After 3 months of starting high intensity statins, if LDL is still more than 100, we add ezetimibe, which will decrease the absorption of cholesterol in the intestine. After 3 months, still it is high, we will have PCSK inhibitors. What are the high intensity statins, which lowers the LDL cholesterol by more than 50%? Outdoor was 40 to 80 and Rus was 20 to 40 mg. Moderate intensity statins include outdoor was 10 to 20 mg, Rus was 5 to 10 mg. If LDL is 70 to 189, if age is less than 19 years, we will give lifestyle modification, avoid saturated fat, junk food, and physical activity. But if familial hypercholesteremia is present, we will start the statins. If age group is 20 to 39, family history of premature ACVD before 55, and if LDL is more than 160, we will give statins. 40 to 75 age group, if LDL is between 70 to 189, we will take the risk calculation. Risk calculator factors include total cholesterol, HDL, and treatment for hypertension or smoker, age group, race, and systolic blood pressure and diabetes. If less than 7.5, less risk, and we will give lifestyle modification. 7.5 to 20, moderate amount of statins, and more than 20, high intensity statins we will give. If LDL is 70 to 189 and patient having diabetes, if age group is 20 to 39 with more than 10 years of type 2 diabetes, with more than 20 years of type 1 diabetes, albuminuria, and EGF are less than 60, if retinopathy or neuropathy are present, in these cases, we will give moderate statins in age group of 20 to 39. For 40 to 75 years with diabetes, irrespective of the condition, moderate intensity statins are given. This is very important. If diabetes is there and LDL is between 70 to 189 in age group of 40 to 75, irrespective of condition, we will give moderate intensity statin. If multiple risk factors are present, we will give high intensity statins. Foods which are good for HDL cholesterol include eat plenty of fresh whole foods, fruits, vegetables, nuts, and seeds, and choose foods with least processing. And phytosterols in raw nuts and seeds are effective for lowering cholesterol. Amla is one of the best cholesterol lowering natural food known, and avoid foods high in cholesterol, eggs, meat, seafood, dairy products, and avoid fried and oily foods. Secondary prevention. Already patient is having MI, CAD, PVD or stroke, and in these cases, we will give high intensity statins. With the absolute value of LDL should be below 70 and 50% of LDL should be reduced. If still not achieved, then we will give ezetimibe. If target we got, we will continue in the same dose. Reason for high triglyceride. If patient having high triglyceride, we will ask him to reduce the alcohol and avoid simple carbohydrates and go for weight loss and physical activity. What are the secondary causes of the high triglycerides? Uncontrolled diabetes, nephrotic syndrome, CKD, estrogen glucocorticoids, and beta blockers, and hypothyroids. Hypothyroidism usually have high LDL and high triglyceride. So normal is less than 150, borderline 150 to 199, high 200 to 499, very high more than 500. Triglyceride between 170 to 150, we will give lifestyle modification, still not controlled, we will give statins. More than 500, lifestyle modification, and we should treat the secondary causes. And we will add phenylpheniramine 145 to 160 milligram per day and omega-3 fatty acid DPA, DHA, and side effects of these drugs include myopathy and elevated creatinine. Low HDL is independent risk factor and more relevant when LDL is not elevated. Physical activity, statins increase HDL by 10 to 15%. So normal cholesterol should be desirable less than 200, triglyceride less than 150, HDL 60, and LDL 60 to 130. Cholesterol to HDL ratio 4. High risk is cholesterol between more than 240 and triglyceride 200 more than 200, HDL less than 35, LDL between 160 to 189, and cholesterol HDL ratio 6. Thank you.
If you have brain fog, if you have no clarity in life, just decrease one element in your life: instant satisfaction. Clicks, games, snacks, drinks, reels, shots, phones, news. The prison doors of your life are closed with the button of instant satisfaction. Be honorable.